Here's something that surprises most Americans. In China, an ambulance ride costs about $50. In some cities, it's free. In America, the average ambulance ride costs between $500 and $5,000. And that's just the ride. The emergency room is extra. The doctor is extra. The bandage is extra. This is China origins. Today we're looking at healthcare. Who actually gets better care? And what does each system value? Let's start with the numbers. China has about 1.8 hospital beds per 1,000 people. America has about 2.9. So America has more beds. But here's the catch. America also has the highest healthcare costs in the world. The average American spends over $12,000 per person per year. That's more than any other country. In China, that number is about $700. 12,000 versus 700. Why such a huge gap? The answer is not what you think. It's not about quality. It's about what each system was designed to do. The American healthcare system was built around choice and innovation. You can see any doctor. You can get any treatment. If you have good insurance through your employer, you get world-class care. But if you don't, or if your insurance doesn't cover something, you can go bankrupt. Medical bills are the #1 cause of bankruptcy in America. Let me say that again. More Americans go bankrupt from medical debt than from credit cards or mortgages. The Chinese healthcare system was built around access and efficiency. In the 2000s, China realized most rural people had no insurance at all. So they built a system from scratch. They invested in community clinics and public hospitals. The goal was simple. Make sure everyone can see a doctor without waiting 6 months. The trade-off is choice. You can't pick any specialist you want. You go where the system sends you. And you might wait in a long line at a crowded hospital. Let me give you a real example. A friend of mine in Shanghai had appendicitis. He went to a public hospital. He waited 2 hours for surgery. The total bill was about $800. His insurance covered most of it. He paid $60 out of pocket. A friend in Texas had the same surgery. He waited 4 hours in the ER. The bill was $34,000. His insurance covered most of it. He still paid $2,000 out of pocket. Same surgery, same outcome, different bills. Now let's talk about wait times. This is where the common wisdom is wrong. Many Americans believe that China's public system has long waits. They imagine lines around the building. But data tells a different story. In China, the average wait for a routine doctor visit is about 20 minutes. In America, the average wait for a specialist can be 3 months. For a primary care doctor, it's often 2 to 4 weeks. Why? Because America has a shortage of primary care doctors. Young doctors prefer higher-paying specialties. So you wait. China has a surplus of general practitioners. They earn less, but there are more of them. So you don't wait as long. But here's the hard part. China's system is not perfect. The quality varies wildly. A top hospital in Beijing is as good as anything in New York or London. But a county hospital in rural Gansu province? You don't want to go there if you have a serious condition. The equipment might be old. The doctors might lack training. America's system is more consistent. A hospital in rural Texas is still decent. But that consistency comes with a price tag that excludes millions of people. 40 million Americans had no health insurance in 2023. That's 12% of the population. They avoid doctors until it's an emergency. China has near universal coverage. 95% of Chinese have basic health insurance. But basic means basic. It covers most standard treatments, but not the newest cancer drugs. Not the experimental procedures. If you want those, you pay out of pocket, or you don't get them. So who has the better system? It depends on what you value. If you want the best possible care, and you can afford it, America wins. If you want to see a doctor without going bankrupt, China wins. But neither system is a model. Both are trying to fix different problems. America is trying to lower costs without losing quality. China is trying to raise quality without losing access. Next episode, we'll look at something very different. Housing. Why do Chinese parents expect their son to own an apartment before marriage? And why do Americans think that's crazy? If you made it this far, you care about understanding, not just winning arguments. That's why I make this podcast. Subscribe. Send this to someone who needs to hear the other side. I'll talk to you in 2 weeks.